This is Cebu City. Home to about 2.8 million Filipinos, it's the center of the second biggest metropolitan area outside of Metro Manila. But in June this year, all eyes were on Cebu. The number of COVID-19 cases here soars to alarming levels, catching the attention of President Rodrigo Duterte.
This is not the first national emergency na ang Cebuano is murag hinay mulihok. Mulihok pa mag-yaw-yaw pa kay Cebuano suburbio.
At the time, Cebu is close to becoming the COVID-19 epicenter in the country. But almost 4 months later, experts say Cebu has flattened the curve. How did Cebu City do it? And what can Metro Manila learn from Cebu's COVID-19 response? It begins in January. A Chinese couple from Wuhan, China arrives in Cebu 2 days after the Sinulog Festival, where an estimated 2 million tourists gathered. From Cebu, they visit Dumaguete before going to Manila. The couple tests positive for coronavirus. On February 1, the 44-year-old husband died in Manila. This is the first COVID-19 death outside of China. On March 28, Cebu goes under Enhanced Community Quarantine, or ECQ. In April, intensive contact tracing in the most congested sitios and barangays is underway. That's when the increasing trend starts. By the end of June, the cases soar to over 5,000, overwhelming the city's healthcare systems as hospitals reach full capacity for COVID-19 patients. Because of the spike in cases, Cebu is placed under ECQ for the second time from June 16 to July 15. From ECQ, Cebu then eases its status to Modified Enhanced Community Quarantine, or MECQ, from July 16 to July 31. Experts say the stricter lockdowns gave a breather to Cebu's health sector and government. Cebu takes advantage of these lockdowns to pick up the pace in its coronavirus response. During the lockdown, Cebu intensifies its contact tracing team to contain the virus. From only 5 contact tracers, the city now has at least 423.
We really get the support, got the support of the barangays because they are on top in making a lockdown on houses that have positive individuals. Mm-hmm. And then they also extract the patients and they transport it to an isolation center.
In September, contact tracers begin to see the pattern of the infection. They reveal that 24% of the new coronavirus infections had visited grocery stores and public markets. This prompts the Cebu Emergency Operations Center to assign safety officers in supermarkets to ensure that customers follow health protocols inside grocery stores. As contact tracing efforts are beefed up, the city government tests more residents. This pushes Cebu City to set up more testing sites, with up to 5 clustered clinics scattered across the city at one point. The increase in laboratory capacity also helps improve the efficiency of swab tests.
To those who manifest symptoms, based on the assessment of the doctors there, they will be swabbed. And then when they return to their dwellings, their house will be locked down, but they will be informed about the procedure.
At the beginning of the outbreak, probable COVID-19 patients have to wait for at least a week for their swab results. Now, the turnaround time for the swab results is only 2 to 4 days. In July, Cebu City also makes swab testing free and available for all Cebuanos, whether or not they have symptoms.
If you feel like you have been in contact with someone that is COVID positive, and then somehow you feel that you manifest some symptoms, like so you go to the cluster clinic, and then there's a doctor there, and then if the doctor, upon his assessment that you have the symptoms, then he will swab you right away. They will also do the contact tracing in your home, and the swabbing the following day.
All these efforts helped Cebu City maintain the downward trend after the strict lockdowns. From August 1 to 19, the Health Department in Central Visayas finally sees the numbers improving, with a daily average of only 23 new cases in Cebu City. By September, the Health Department declares Cebu City has flattened the curve.
Yes, so bale, the numbers that we are seeing already is a very good number. I think we have really flattened our curve, no, here in Cebu City. And considering na we are already entering the second week of MGCQ, and yet our number of active cases or additional new cases hasn't really hit beyond no sa atong expectation. So magkita nato nga gwapo kaayo ang ato ang numbers, and we hope na it will continue to be like that.
On October 13, Cebu City achieves its lowest coronavirus positivity rate at 0.5%. This is a large decline from the 33% positivity rate of Cebu City in June. Positivity rate is the percentage of people who test positive for COVID-19 from those who have been tested. The World Health Organization recommends a positivity rate of 5% or below to control the pandemic. With its numbers improving, Cebu is now under Modified General Community Quarantine, or MGCQ, the least restrictive quarantine status. What works with Cebu City's coronavirus response is this: stricter and longer lockdowns, aggressive contact tracing efforts, free mass testing. Now the only challenge for Cebu is to prevent a second wave of infection. Meantime, Metro Manila continues to be a COVID-19 hotspot. It remains under General Community Quarantine, or GCQ. Despite this, the COVID-19 Task Force on October 15 begins easing domestic travel restrictions between areas under MGCQ and GCQ as tourism slowly opens. It's too early to tell if the relaxed restrictions will cause a spike of cases. If Metro Manila can adapt Cebu City's formula, perhaps it can successfully flatten the curve before the year ends. Ryan Macasero, Rappler, Cebu City.